quick, let me give an update really fast. So I had the crazy ultrasound yesterday. My medications were supposed to come last night and they did not. So I did not take my Menopur dose last night. And so came in today for an ultrasound, let them know that I did not have my Menopur, and that I wasn't gonna have it because they have not updated the mailing of when I could expect it. So he was like, well, you would have to wait until your period to start again. And I'm like, unless you want to, and he's like, unless you want to move forward. And I'm like, well, ideally I only get 2 more cycles, regardless of whether this cycle finishes or not. They're going to charge me for, they're not charge me, they're going to count it against me. So I'm only going to have 1 cycle left. So ideally, if it's not going to hurt to continue the cycle, I would like to continue the cycle. And so he was like, you know, that missing that 1 dose could throw off the cycle, whatever. What would I do for meds if I don't have it? And I'm like, I don't know if you guys have another pharmacy I could buy them from or get them from. I don't have a problem. He was like, well, we have medication. I will have to see what we have, but you will have to pay for it. And I'm like, okay, I'm not asking to not pay for it, but I will have to get the medication from here in Jacksonville, because if the weather is bad other places, I'm not able to get the medication. Anyway, he's like, you know, let's go over here. Let's see what we have in the room. Cool. So we go in there, go in the room, check to see what he has. And they have donated Menopur, lots of it. So I won't have to pay for it. So he was like, can you just give her enough for today, tomorrow, and for Sunday. And then we'll see her Monday at 4. And so I'm like, cool. So that's the plan. I feel crampy. Still didn't want to scan me. I asked him if I should have been scanned. I took an ovulation test yesterday. It was nowhere near positive. And so, yeah, we're going to take it the next 3 days, come back in, take a scan, see where we're at. I don't really know. I don't know. Not sure what's going on. So we will see. And I forgot to update, I did get my progesterone levels back. It was -5. I think anything over 3 is that I ovulated. So I was nowhere near ovulating based on my blood work. So I did not ovulate. So we don't know where those follicles went. So another update. I'm getting gas right now. So I'm just going to give the update since they just called me. So once I left the fertility clinic, I started pondering on if I was being just too aggressive and wanting to continue just because I would lose out on the cycle. And so I was, you know, contemplating on if I should give them a call. Well, they gave me a call. And originally my appointment is for Monday at 4:15 in the afternoon. And so he changed it and he wants to see me on a Sunday, which is like unheard of, but okay. He wants to see me on Sunday at 7:30. And so I asked her to ask him for me if he just really felt in his heart that it was just not worth continuing because I missed 1 dose of the medication. And she was like that's the reason why he wants to see me on Sunday, is that based on that scan, it would let him know if he wants to continue with the cycle or not. So we will know, we will do the medication today and Saturday, and then on Sunday, based on my scan in the morning, we will determine if we're going to continue or not with this cycle. So it's going to either go left or go right. But we tried, and so this is all we can do. So yeah, I will, update you guys on Sunday, because besides the 2 days of the meds, nothing else is really going to be happening. So, all right, talk to you guys Sunday. All right, so here is the next awaited update. So it is Sunday, and I had to be here at 7:30 in the morning, which is crazy because why? So the last appointment, I did not have anything that was able to be triggered. He wanted to cancel the cycle because of the lack of response and the disappearing of the 2 big follicles that I had. Well, it's amazing what 2 days difference makes. Insane, actually. So I went from no triggerable follicles to having 4 mature ones on the left side and 2 on the right side. So I have a total of, 3 on the left, 2 on the right. So I have a total of possible 5 I have 5 mature follicles. And so he had the come to Jesus talk about multiples, and there's a high chance of this turning into 5 babies instead of 1. And because of the new laws in Florida, you are not able to do reduction. So meaning if I were to get pregnant with 3 or 4 babies or 5, we couldn't reduce them to a safer number of 2 because of the new laws. And so he is not comfortable moving forward with the cycle. He asked me what did I think. Emotionally, it's like, okay, if we've had 3 mature follicles and we have not gotten pregnant yet, it doesn't excite me to see 5 because there's still a chance that none of them fertilize. However, I'm also thinking of it as from the perspective of I have a 3-year-old. I need to be here for my family and not to be, I can't afford to be on bed rest with 5 babies. And who the hell can take care of 5 babies? And the risk that comes with the NICU stay, I'm looking at all that stuff. And so if I trigger, all of them are gonna release. I don't know what that would mean for if we were to try naturally. So I don't know. I took an ovulation test last night and it was so close to being positive. It wasn't positive, but it was close to being positive. So I think the first thing I'm gonna do is probably stop and go get an ovulation test and just track for ovulation. I'll ask my husband what he wants to do. He may not want to try naturally because that is 5 possible babies. So the plan is, he was like that I could take the cycle and switch it over to IVF. My insurance does not cover IVF. But he said if we could take the eggs out and then we could fertilize them, make embryos, blah 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 blah. Okay, well, we don't really want to do that because it's not covered, and we still have 1 more free cycle of time intercourse. So I talked to him and he was like, well, you responded really, really good to 2. Maybe let's do 1. And so the plan is to wait for my period. If I'm not pregnant, then we would switch my dose of Menopur from 2 vials in the 1 cc to 1 vial in the 1 cc. And then if it does not work and we're not pregnant, then the next step would be IVF. So that is where we're at. I am not super angry. I respond well. It just sucks because like we were already on pins and needles about it being canceled because of not responding. And now it's not that we're not responding, we're responding too well. And it's literally been 2 days. So it's like, what the hell? Like, we go from not responding to over responding. And it's like, I don't know, just not being able to catch a break with this. So that's where we're at. All right.